Its name is Cyclospora. It's a microscopic parasite behind a massive surge in intestinal illness across the United States. And the main symptom is explosive diarrhea. Now, since May 1st, cases of cyclosporiasis have been reported in 47 states. More than 10,000 infections have been confirmed, and there have been 517 hospitalizations and 2 deaths. But those figures do not represent one single proven chain of infection. Officials are investigating several clusters and potentially several sources. One major outbreak has been linked to recalled iceberg lettuce sourced from central Mexico. Well, joining me now is Donald Schaffner. He chairs the Department of Food Science at Rutgers University. He has spent decades studying microbial risk, food contamination, cross-contamination, and hand washing. Rutgers Magazine dubbed him Mr. Clean. He helped demolish the 5-second rule, the comforting belief that food dropped briefly on the floor remains safe to eat. It doesn't. Don, it's good to have you on the program. So I want to pick up on that. Rutgers calls you Mr. Clean. So tell us what makes Cyclospora so difficult to wash away.
Sure. Well, we don't know a lot about this organism in general. It's very difficult to work with. So it's different than other pathogens like Salmonella and Listeria, which we can easily work with in the laboratory. So it's difficult to culture. We can't culture it outside a human host. But we also know that maybe there are some attributes of the parasite that make it difficult to wash off. It may physically attach to fresh produce in some cases.
Our graphic shows cases in 47 U.S. states at the moment. Is this one national outbreak, or are we looking at several outbreaks unfolding at once?
Yes, there's definitely several outbreaks, or more than several, depending on your definition of several. If you look at FDA's webpage, I think the last time I looked, there were 6 different Cyclospora outbreaks. One, which started in June, FDA has declared that over with no source identified. There's one that we're all talking about, which is the source is a epidemiologically implicated iceberg lettuce. Mm-hmm. And then there's several other outbreaks that don't appear to be linked to that one, and we still don't know the cause.
Yeah, I mean, I want to pick up on this recalled lettuce. It has been off of the market now for weeks. Do we know why case numbers are still rising?
There's always a delay. So first of all, it's important to realize that one of the unique things about Cyclospora is the incubation period is rather long. So from the time you consume the food until you get sick, maybe as long as 2 weeks. And then there's specialized tests that we need to do on the feces, the diarrhea, to find the parasite. And then after that, that person has to be interviewed by an epidemiologist to see whether they're actually part of the outbreak or not. So there's a very long lag. So my strongly held opinion is that any contaminated lettuce is already off the market, and we're just seeing additional cases come up from people that were exposed 1 month ago, 6 weeks ago, et cetera.
The only positive food sample, if I've got this correct, was later ruled a false positive. How strong is the case then against lettuce?
Well, it's important to realize that the case against lettuce is strictly based on epidemiology. In other words, we find people with Cyclospora in their diarrhea. We ask them what they ate 4 weeks ago, 6 weeks ago, and that's the signal that says, oh, we think it's lettuce from this particular restaurant chain that was sourced by this particular supplier. The false positive is nothing but a false positive. It was a lab error. It doesn't mean anything except FDA maybe has a little bit of egg on their face from that screw up.
And the way this parasite is spread, I mean, it reaches food through fecal contamination. And we're talking about human feces that's infected with the parasite. It has to come in contact with food that people then eat. Where did the system, in your opinion, most likely break down?
Well, remember that we have multiple outbreaks going on right now, so there might be multiple different breakdowns. We still don't have a lot of information, from what went on at the Taylor Farms, New Mexico location. My understanding is FDA is only now getting boots on the ground at that location, and they'll be doing their full inspection. There's still just a whole lot that we don't know. So, yeah, I mean, it's just a big question mark at this point. Yeah, but I suspect that in all of these, water is somehow involved, right? Because the organism is easily transmitted through water.
The lettuce, just to stay on that for a second, it moved through a national supply chain before the alarm was raised. What should have caught this earlier, or Should there have been anything that would have been able to catch it?
Yeah, the nature of testing contamination is sporadically present, and it's present at low levels. So we're never going to find it with testing. We really have to rely on the operations that are producing food to be following best practices. And every indication is that Taylor Farms was doing that. So it's going to be very interesting to see what the eventual broken link that caused the outbreak is.
You know, we assume that this contamination was accidental, but has it exposed a vulnerability that a hostile actor could possibly exploit?
Well, I think the hostile actor, it's like Pogo. We've met the enemy and he is us. The hostile actor is us. We have a failing infrastructure in this country with respect to water and water treatment. Cyclospora appears to be endemic in the United States, or at least there's some indications of that. And we're also cutting funding for research. And so honestly, we're doing it to ourselves. We need to invest more in research. We need to rebuild the infrastructure in this country so that we stop having problems like this, or we have them less frequently.
I know you've spent years studying hand washing and hygiene. What can consumers actually do now to protect themselves?
Well, unfortunately, there's not a lot you can do with respect to items like fresh produce. Obviously, it's still good advice to wash your hands. It's not going to stop you from getting Cyclospora. It's good advice to cook your food thoroughly. We're not going to start cooking our lettuce anytime soon. So we really are reliant on the food companies that produce this food for us to do it in a safe manner.
And let's say someone has the symptoms. When should persistent diarrhea prompt someone to ask specifically for a Cyclospora test?
That's a great question, and probably it depends upon your insurance and your doctor and questions like that. Certainly, if you have diarrhea for more than 24 hours, you should see a doctor. If you think that you might have Cyclospora, which is this relapsing diarrhea where it gets better and then it comes back again, if you have those kind of symptoms, you should definitely see a doctor and request a Cyclospora test.
You know, and if we look at the numbers, we've got more than 500 people who've been hospitalized. We've got 2 deaths so far. Is this an unusually difficult parasite, or is this evidence, as you were hinting at earlier, a food safety system that is failing?
Well, I think it's really important to realize that this is an unusual organism, and we just don't know a lot about it. It's difficult to test for. I think at this point, food supply is probably safe, but obviously we could still have problems in the future.
And I keep coming back to this, but I know people are asking themselves this. The FDA, the CDC, have they responded as effectively as possible, or as effectively as they should have?
Well, we know that there have been budget cuts at both of those agencies. There's also been cuts at the USDA, Agricultural Research Service. All of those things didn't cause the outbreak, but they certainly seem to have been slowing down the response. So, yeah, I don't blame my colleagues at FDA and CDC. I'm sure they're doing the best that they can, but they're under-resourced and understaffed.
And considering the situation is as it is, let me just ask you, have you stopped eating leafy vegetables, blueberries, and apples?
This is a beautiful time to eat fresh produce here in the state of New Jersey. I have not changed my consumption patterns one bit. I had a salad for dinner last night. I'm going to have a salad for dinner tonight, and I'm going to enjoy it and not worry too much about getting sick.
Let me ask you before we run out of time. Last year, the Trump administration changed the regulations for tracking and tracing Cyclospora and several other pathogens from mandatory to voluntary for states. How has that affected the handling of this outbreak?
I don't think it has affected this outbreak so much as it's important baseline data that we need to understand what's going on. It's like cutting off our radar so we can't see the magnitude of the problem. Again, in retrospect, a poor decision to remove Cyclospora from mandatory food net reporting.
Yeah. Don Schaffner, good to have you on the program. Good to get your insights on this. We appreciate your time tonight. Thank you.
My pleasure. Thanks, Brett.